My friends, I want to talk to you today very simply about government.
And the need to use diplomacy and build international consensus to resolve our problems whenever possible.
Our diplomats are working with a range of partners to strengthen human rights protections.
This is not a time to undercut our diplomats.
Hello, and welcome to Diplomatic Community. I'm Kelly McFarland, Director of Programs and Research at Georgetown University's Institute for the Study of Diplomacy. Cities are hubs of innovation, technological and demographic change, and in some cases, diplomacy. But because they're densely populated, urban areas are also some of the most susceptible to infectious disease outbreaks. As we have seen over the past 18 months, the COVID-19 pandemic hit cities hard. Because many governments, particularly in some of the world's wealthiest countries, failed to get the pandemic under control, city and local governments have played a particularly important role during this pandemic. ISD has spent a lot of time thinking about the role of cities in international relations and diplomacy over the last few years. As part of our new Global Commons Working Group series, our 2019 report, entitled The Rise of Metropolitanism, the International Order and Subnational Actors, explored the roles of cities, municipalities, and other subnational actors and the networks they create across national borders. You can find a link to the report in the show notes. The pandemic has highlighted both the strengths and the weaknesses of cities on the international stage. In many ways, cities and other subnational entities have the freedom to act more quickly than national governments due to nimbler bureaucracies, but they can also be hampered by that same lack of formal power and other legal restrictions. Cities have no clear space within the international community and within international organizations, which can also hamper more widespread and coordinated action. We wanted to find out more about how cities and national governments have fared during this pandemic, and what lessons academics and policymakers can learn in preparing for the next one. So I spoke to two of our Georgetown colleagues who are bridging the divide between the academic and policy worlds. Dr. Rebecca Katz is a professor and director of the Center for Global Health Science and Security and holds joint appointments in Georgetown University Medical Center and the School of Foreign Service. She teaches courses on global health diplomacy, global health security, and emerging infectious diseases, and has also written a diplomatic case study for ISD on global health institutions. She has authored over 100 peer-reviewed manuscripts and 5 books, in addition to numerous op-eds, blogs, white papers, and book chapters. Her latest volume, Inoculating Cities, Case Studies of Urban Pandemic Preparedness, is particularly pertinent to today's episode. From 2004 to 2019, Rebecca was a consultant to the Department of State, working on issues related to the Biological Weapons Convention, pandemic influenza, and disease surveillance. She returned to the Department of State in January 2021 as a senior advisor on the global COVID-19 response and on global health security, and recently returned full-time to Georgetown. I was also joined for the conversation by Matt Boyce. Matt is one of Rebecca's PhD students in the Global Infectious Diseases program at Georgetown. As well as being the co-editor of their new book, Inoculating Cities, Matt was a staff member at Georgetown University's Center for Global Health Science and Security from 2017 to 2020, where he contributed to tools and data sets housed in the International Disease and Events Analysis platform, worked on urban pandemic preparedness, and response efforts to the COVID-19 pandemic. You can find Matt on Twitter at MattRBO, and Rebecca at Rebecca Katz 5, that's figure 5, and you can follow ISD at GU Diplomacy. We hope you enjoy the conversation, and we welcome any feedback over email to diplomacy@georgetown.edu. Let's listen to the conversation. I'm joined today by Rebecca Katz and Matt Boyce, both of Georgetown University, to talk about global health today, and also a little bit about city diplomacy and cities' roles in global health. And we're going to start off with a pretty heavy question today. And Matt and Rebecca, welcome. Thanks for joining us.
Thank you, and we're delighted to be here.
It's obviously been a difficult 18 months dealing with COVID and the pandemic, both in the United States and globally, trying to curb this as much as we can. And there's many different angles and aspects of this, whether or not you want to talk about, lockdowns and travel restrictions or vaccinations, and trying to get vaccinations to as many people as possible, not only in the United States, but around the world to try to curb this. But Rebecca, I want to start with you, and just kind of broadly speaking, in your mind, what what are some of the things that have gone well in the global response up to this point, and what's gone particularly badly in your mind? I mean, I know there's probably multiple answers to both of those, but if you have a couple key ones that you kind of think about on a regular basis.
Yeah, I thank you for that. I think listen, we are it's what day is it? It's October 28th when we're recording this. We are now we still continue to see increases in weekly case counts from around the world. And we're now at close to about 5 million recorded deaths around the world. And I think the best guess right now is that it's probably closer to 10 to 15 million people who have died. And honestly, it's going to take years to actually figure that out. So, what's gone bad is that, oh my gosh, there's been this tremendous loss of life around the world. And not and 240 250 million recorded people who have been impacted, the economies, I mean, all the things, right? Like all the things that were predicted that would happen in a pandemic that we've had. We're public health people, so we start with morbidity and mortality, and then out from that you can look at the economies that are failing around the world and what the long-term implications will be of that for vulnerable populations, for food security, for all the humanitarian concerns, right? But I think specifically on the what's going well with the response. Well, I think the easy answer there is we have medical countermeasures, and that is a really big deal, and it's worth repeating over and over and over again. Is that we are 21 months into this pandemic, and we don't have one, but we have more than a dozen vaccines that are being utilized around the world. We have several extraordinarily effective vaccines that are being used throughout the United States, and that is something that I think we need to say over and over again. Like we are extraordinarily fortunate that we have such effective medical countermeasures, and that there have been advancements in treatment as well. So that goes high into my bucket of like what's going really well. Now I think and depending on where you sit, I would either say that global cooperation, the response is going really well, or you put that in the category of one of the things that's going really horribly. But why don't I pause on what I think is going well and flip over to Matt?
So, I mean, I think I would agree with everything that you just said. I think in addition to that, one of the things I think that has gone well, and I mean, I guess I should preface this with maybe it's a little bit of a mixed bag, but is this idea of evidence-based approaches in policy. I think one of the things that's been a little bit unique about this pandemic is that we've had more data than we have in previous responses to epidemics or public health emergencies. And I think that some places have actually done a really good job of using that data to their advantage and informing policies about, when to shut things down, when to open things back up, where to target specific interventions like testing, so on and so forth. So, I mean, I think that would be, I guess, a relative success.
Yeah, as a historian, I think what really hit me, and knowing that the overall population numbers are larger than they were 100 years ago, but when we hit the number dead in America that equaled the amount that died during the Spanish flu in 1918, as a historian, you read about the Spanish flu and what was going on then, and it's horrifying to think about like living in a world like that, and yet here we are living in a world where 600,000 and now going on 700,000 Americans have died, which is more than died during the Spanish flu of 1918, 19, is really humbling and scary to think about. But I have a follow up to what you guys just mentioned, put into perspective for listeners just how amazing it is that we do have treatments for this already, and that we have all these vaccines out there that are highly effective. and what that sort of took. And then on the flip side of this, Matt, you mentioned that policies based on data and based on science, but we were also running into this issue of a lot of misinformation and disinformation out there. And if you could kind of talk a little bit about how difficult that is making this in the long term.
Well, I'm happy to jump in. I think for contrast, we're now approximately 40 years into the HIV/AIDS pandemic, and we don't have a viable vaccine candidate. In the last couple of weeks, the WHO, for the first time, approved a malaria vaccine. Well, maybe not the first time, but like in a recent history, we now have a malaria vaccine, and it is being hailed as a massive kind of win for global health. And that vaccine is just over 50% effective and still being considered a massive win for global health.
And requires 4 doses too.
Yeah. So the like it for contrast for HIV/AIDS and malaria, two of the three biggest infectious disease killers in the world. We're that's where we are in the vaccine game there. So the fact that that we have so many vaccines that are circulating right now with multiple different types of platforms is really incredible and impressive, and did not happen by a miracle, right? Like there was years and years and years of basic scientific research and development of different platforms that was behind all of this, right? And those are the years where nobody's paying attention, and those are the years where it's really hard to continue to get approval for funding, because it's a thing that nobody wants to talk. Nobody wants to talk about a coronavirus. Nobody wants to talk about hemorrhagic diseases if you're not being impacted by them. And so I think it's critical to continue to emphasize that particularly the mRNA vaccines that we have, one of the reasons they were able to develop those so quickly was because of a decade of research that had gone into the development of those platforms. Matt, I'll turn to you to try to answer Kelly's question about misinformation and disinformation.
Yeah, that's a hard question that I don't think we have a great answer to just yet. But I mean, I would agree that I think it's been a huge issue and a huge challenge throughout this pandemic. It's one of those things. I think if the public health community, and I guess the health security community more broadly, does some critical self-reflection, I think reasonable minds can disagree, but I think most would probably say that risk communication and communication with the public probably could have been handled a little bit better, about communicating what we know and more importantly what we don't know at this time, and just being transparent about why the recommendations that are being made are being made. One of the early debates that I think back to that we're still having to this day is whether or not face masks work. And the answer is yes. But early on in the pandemic, we weren't necessarily sure that they did, and the public health community was divided. And then as we learned more about the virus and more came out, we learned that they do work, they are important, and it's going to be a big part of controlling this disease and this pandemic. But a lot of the information that was out there is still out there, and people will pick it up and recirculate it and call out experts in the field now for saying, well, you said on March 15th 2020 that masks didn't work, so why are you saying they work now? And the answer is, well, because that was March 15th 2020. It is now October 28th, 2021. We know a lot more. Um, and I think it's a challenge that really has been faced on all levels too, whether it's the WHO or national governments or state governments or local governments. Everybody is faced with this difficult task of responding to people who have understandably a lot of opinions about, it's arguably one of the defining events of the past century. So I think in the future, I think more effort needs to be put into figuring out what the best way of communicating science and very complex science to the public is, and even between authorities too. So making sure that everybody has a common understanding of what the science is saying, what it's not saying, and what we do and don't know, I think is one way to address some of those challenges moving forward.
In any emerging infectious disease, you have to operate and make decisions under uncertainty, and that's the name of the game, and that's how this works. And being able to effectively communicate that uncertainty and still try to encourage best practices as they're known at the time is a challenge that's been going on for a really long time. It's something that the public health community hasn't always been terrific at, but is learning and has learned a lot throughout the course of the pandemic. I think the other challenge with this pandemic, though, is there's misinformation, but there's also disinformation. So there has been active efforts to spread wrong information for a variety of reasons, but also as kind of malicious actors out there, and whether those are state actors or not. And so in addition to fighting the regular challenges that we have of uncertainty and keeping up with the science and effectively communicating in a way that influences the appropriate public behaviors, there's also this other thing going on, and which is it's kind of hard to quantify, but we know it's happening. And I don't. This isn't a community that has really been kind of doesn't have the full toolkit for trying to address when you have malicious actors working against you in a public health event.
Yeah, that's important to point out. And we've done some work at ISD on misinformation and disinformation and information operations in general. And that's a hard thing to do. And we're still, that even that community that specializes in that is still trying to figure out the best approaches to combating that. And I think just points you make about trying to have scientists and the health community speak to the public in a way that is that can help build trust, but also saying that, like, this is what we know right now. We might not know everything. I think that goes a long way towards building trust. And I mean, I remember as you guys were talking, I remember, the first month or so of the pandemic, I was, going to the grocery store without a mask but with rubber gloves on, and was coming home and like basically hosing down my groceries, right? And, stuff that you don't even think about doing today. I mean, it's we all can probably wash our hands more, which is good. But yeah, it's just, I think having that knowledge that, this is new and data changes. And as we can study this more, we'll get better at knowing what works and what doesn't. But I think Matt made a point too, that on scientists and the health community doing a better job to have these talks with the public and communicate these things gets to the next question a little bit. Eventually, COVID will fade away into the, maybe not from a scientific and disease standpoint, but in people's conscious and their minds and everything, as we just kind of move forward in the world. And we run the risk of this falling back and global health falling back to something that's not thought about that much. And, we all know the stories of the Obama administration putting in a person doing global health on the National Security Council, and then the Trump administration getting rid of that position and things like that. What do we need to do to make sure that we are better prepared the next time, and we don't sort of have to play catch up as much as we did right off the bat?
Yeah, so that's an answer we probably can't probably can't do in a really short period of time, but let me give you some of the highlights, right? I mean, I think that this is what our entire discipline is struggling with, and there are a lot of things in motion right now, and it's good that there's a lot of things in motion because we operate in the cycles of panic to neglect, and we are careening towards neglect right now, and I think that there is a lot of anxiousness to figure out how much change we can make right now while there is still attention of the world, before attention fades and we're on to the next crisis. So there's a lot of different ways to think about all the stuff that has to get done, but at the core, what we're talking about is rebuilding the global health security architecture. And there's a lot of pieces to that, and there's a lot of things that from the the global umbrella to the subnational, which is something that we've spent a lot of time thinking about. But there are many different ways to think about the categories for what all that would look like. Academics are putting forward different types of categorization, but in my head, there's basically about 4 different buckets of this architecture that's going to have to be addressed and fixed. And even before going into them, it's important to say that they're all interconnected, right? If you pull one string, it impacts another. And so if we think about those categories, the first would be thinking about how do we look at the organizations and platforms and systems that we already have, figure out how do we modernize and strengthen them, and also address the gaps, right? So where we don't have the right organizations or systems or platforms, to figure out, do we need new ones? And this would include everything from how do we modernize the World Health Organization to be more effective in terms of global governance of disease? How do we look at platforms for research and development and manufacturing of medical countermeasures and supply chain? And what does the global surveillance system look like? And so I think you have all of that bucket. Then you've got which is huge, right? I mean, even just putting the idea of the research and development in there makes that bucket extraordinarily expensive. You also have another bucket of thinking about norms and standards. So what are the international agreements? How do we govern this space? And just like with the organizations, you're going to look at what we already have. How do we strengthen it? And then where are the gaps? And if there's gaps, can those be addressed through strengthening the existing regime, or do we need to create new agreements? And those are the discussions that are currently underway in Geneva. There's a lot in there, right? So it's everything from strengthening the international health regulations, which is the governing instrument for global health security, to looking at the information sharing regimes, which then touches on how do we actually do global surveillance, to the World Trade Organization and TRIPS waivers and intellectual property rights, and then all the way to the deliberate side where we look at the Biological Weapons Convention. So we have that's like a second bucket. A third is how do we pay for all of this, to see if the finance ministers from around the world can agree on how do we set up a new financing mechanism that would finance not only future response, but also preparedness. And that's not cheap. Now, it's not as expensive as, say, the global war on terrorism, but we're still talking about, billions of dollars every year. Now, if you look at the return on investment, it's cheap, right? We don't actually know exactly how much the current pandemic has cost, but it is in the double digits of trillions. And so maybe it's in like the 22 trillion count at this point, and we'll know more over the coming years. But that is one bucket of like, how do we pay for all this, and how do we sustain financing so we don't, again, slide back into that neglect cycle? And then the final bucket to think about is this notion of governance. So can we set up all of this in a way that is transparent, accountable, and what does oversight look like? And there's there's a lot of proposals circulating for all of these things. There's nothing that is current. There's nothing that's set in stone at this point. So everything right now is in swirl.
I mean, it really is stark on thinking about what we should be spending on this versus other potential spending buckets. So I think that's an important point to raise. And I would like to plug right now, since Rebecca mentioned it as well, she wrote a fantastic case study for us in our case studies library, which I believe the title is Global Governance of Disease, that sort of traces the stages of creating the global governance regime on disease and everything. So any instructors out there listening that want to talk about this stuff in class, that's a good case study to use. So, but I would like to shift a little bit, and you actually mentioned something that allows me to segue pretty easily. But the two of you just came out with a co-edited book that talks about subnational diplomacy, and it's called Inoculating Cities: Case Studies of Urban Pandemic Preparedness. So, broadly speaking, what are a few of the key takeaways that you guys found when looking at this stuff from the subnational level? Yeah, Matt.
More than happy to talk about the book. I mean, the work on the book actually started well before anybody had even heard of the SARS-CoV-2 virus or COVID. So it was very much an ongoing effort, and kind of the idea behind it was we recognizing that historically the governance of public health has largely been an issue that's been reserved for subnational governments. We really wanted to look at what those subnational governments, specifically those in cities, were doing to prepare for pandemics. And at least for me, I think some of the key takeaways from that are, I mean, different models and roles vary drastically around the world depending on the governance schemes and systems that are set up, the underlying legal institutions and frameworks, so on and so forth. But really, what is kind of I would say pervasive across all of it is that uh, local governments, like those in cities, they tend to be a little bit more nimble than higher levels of government, and so they can be more creative in, I guess, the approaches that they use, and taking the guidance issued by either national or supranational authorities and tailoring it to meet the unique needs of their contexts. So, I mean, one example of this is being able to take, say, an epidemiology training program, and create a custom version of that specifically for a city, um, or taking, thinking about bringing this back to COVID, taking the testing guidelines, and knowing where vulnerable populations are in the city, and so really, making sure that tests are available and accessible to those populations, because if they're not able to know whether or not they're infected, really the entire city's at risk. So I'll stop there and turn it over to Rebecca.
There had not been a lot of attention to this issue pre-pandemic, right? We had there, but this was work that we had been involved in for about a decade, and starting in like 2017, 2018, we started to get involved with the Global Parliament of Mayors, and so we had been working closely with that organization and trying to raise awareness, and we had been developing tools that cities could use. In fact, one of our last international trips pre-pandemic was to Durban for the Global Parliament of Mayors meeting, where we had previewed a tool we had developed for a rapid urban health security assessment tool. And I think, so we had been doing a lot of thinking about the fact that, and we had been involved with the World Health Organization a little bit, and we knew that there was work going on around the world, but there wasn't a great mechanism for sharing it. And there was tremendous amount of variation in in which cities were doing what. And so this book was an opportunity to try to capture some of that work, capture some of those best practices, um, as cities kind of struggled. Now, I think what we've clearly seen throughout the pandemic is that a lot of what we had predicted and discussed in terms of, and almost like hypothesized that cities would be on the front line for a lot of decision making, turned out to be very true. And now there's clearly variation in authorities, from country to country, and you'll have some cities where a mayor has kind of full authority for the hospitals, for transportation, for schools, for quarantine, for international like all of it. And then you have some cities where their authorities are limited. But one of the opportunities of doing these types of edited volumes is to bring together different examples from those different governance structures. Um, and I think one of the when we first put this book out, we immediately got calls for when's the next volume happening, right? Because when's the next one coming out that's going to solely focus on COVID? And I think there continues to be a lot of interest and a lot of work that we can do to help showcase models for governance and activities that happened at the city level, in different resource environments, right? So you can look at like what contact tracing looks like in New York versus Kampala, um, and where technology helps, where it doesn't help, right? I mean, you can start to look at all those things, but I think there remains an interesting question, and kind of gets to the core of your question, that there doesn't seem to be really. I don't think there is a well-developed idea yet of how to integrate subnational authorities into the global system. And this gets kind of to the work that you had been doing before. And it still feels murky, right? It still feels like there's this acknowledgement that, the mayor of a megacity is a true player, in not just governance for disease, but in climate change and in lots of other issues. But they don't dock in well yet.
Yeah, and I think that's an important point. I mean, I think this is going to be a continuing discussion on the roles that cities can play, the roles they can't play, because of, like you mentioned, the authorities and the different every city has different authorities and what they can and can't do, on the not only the federal level but on the international scene. And I think, you mentioned the work we did on this, and I think you were at least at one of the meetings. At least, we partnered with the Georgetown's Global Cities Initiative for one of our working groups, and did a report called "The New Metropolitanism," talking about subnational diplomacy. And I global health is one of the things we discussed in that. But I think it's and it's also something that, like global health, waxes and wanes, right? I mean, I think during the Trump administration, you saw subnational diplomacy in action expand, because there was a difference between the policies of the federal government and what cities wanted to do. So they were moving out front on things when they could, like climate change and things like that. So, and now that things might align more, you might not see as much forward momentum from cities out in front leading on things. So, this will be an ongoing discussion, but an important discussion, as you guys note and as your book discusses. So, on that, I'm going to let you guys get out of here. Any final thoughts? Is there like one thing that we should be doing that we're not, or that you would like to see more of?
I don't know what the one thing would be. I mean, I think that we still have a challenge of trying to vaccinate approximately 70% of the world, and that's going to take a tremendous amount of global cooperation. It's going to take money, and it's going to take manufacturing, distribution, and so I think that is a key component of this, but also at the same time, I think we're starting to see how do we operationalize making global health security a more integral part of foreign policy and diplomacy in general. And so I think that there's a lot of work to do, but also a lot of excitement in that, a way to try to build on this movement and to see where the field goes.
I'm not sure I could add anything a whole lot better than that. So I guess just thanks for having me. It's been a blast and a lot of fun.
Thank you. Thanks for having us.
Well, thank you both for taking the time. I know you guys are both really busy, and we appreciate it. Congrats again on the book, and best of luck moving forward. Thanks, guys. That was Diplomatic Immunity. Thanks for listening. Please rate, review, and follow this podcast wherever you listen, and tell your friends and colleagues to come find us on Apple Podcasts, Spotify, and all other major podcast platforms. Thank you to the Carnegie Corporation of New York for their support for this podcast and for ISD's research on the new Global Commons. Be sure to join us for a very special final episode of Season 3. Until we meet again.